Now this week, a judge in Florida decided that this Affordable Health Care Act was unconstitutional. But before we get carried away with that decision, step back. This law has been challenged 16 times in federal courts. 16 times. 12 courts have dismissed the challenges on procedural grounds, saying that the person who filed the suit didn't have standing in court. 4 of the federal courts decided it on the merits. 2 of the federal courts decided it was a constitutional law, and 2 said it was unconstitutional. And you say to yourself, wow, 2 federal district courts said this law was unconstitutional. Aren't you worried? Well, I don't take anything for granted, but I do understand a little bit of history. What other laws in America were found unconstitutional by lower courts and then constitutional by the Supreme Court? Anything significant? Social Security was found unconstitutional. Then the Supreme Court said, no, it's constitutional. The federal minimum wage law was found unconstitutional by a lower court, and then the Supreme Court across the street said, no, it's constitutional. The Civil Rights Act of 1964 was found unconstitutional by a lower court, and then across the street, the Supreme Court said, constitutional. So let's not get carried away with lower court decisions that are clearly split on this issue. We had a hearing today in the Senate Judiciary Committee that I chaired, brought in constitutional experts from across the United States. It was a good-spirited hearing. A lot of differences of opinion between the Democrats and the Republicans. But I think the case is clear and strong that we have the power under Article 1, Section 8 of the Constitution, the enumerated powers of Congress, to regulate commerce. Is there anyone on the Republican side who's going to stand here and argue that the health care industry, the health insurance industry, which represents 18% of the economy of America, is not commerce? Well, of course it is. And then, of course, we have the authority under that same section to pass laws necessary and proper to carry out the responsibilities and authority given us. Well, here's what we're trying to do. We're trying to make sure that everyone in America has health insurance. We say that to the 83% of Americans who currently are insured, you don't have to worry about this argument. You already have health insurance. For the 17% uninsured, many of them are people who have pre-existing conditions and have been denied coverage, can't afford it. Some of them are people that frankly can't afford coverage even if they don't have a pre-existing condition in the family. This law moves us to the point where more and more Americans will be covered with health insurance. And we say at the end that those who can afford health insurance and don't buy it will pay a tax because of that decision. Now, is that heartless? Is that a federal mandate on people who just want to be left alone? You know, if they were just being left alone, it's one thing, but I'll tell you what human experience teaches us. These people who want to go it alone, don't bother me, I'm on my own, are going to get sick someday. And when they get sick and go to the hospital, they will be treated. And when they can't pay for their treatment, do you know who will pay? All of the rest of us. Everyone else paying health insurance premiums has to absorb the cost of those who are freeloading on the system. It's not fair. It used to be that conservative Republicans preach personal responsibility. When we put personal responsibility in this law, all of a sudden they don't like it. I think personal responsibility still counts, and I believe it is clearly constitutional to include it. I listened to some of the arguments about repealing this law. I heard the senator from Mississippi say how bipartisan the support is for it. I would have liked to have asked him how he explains the fact that 4 out of 5 people in America, 80% of Americans, oppose repeal. They don't think the law is perfect. Many of them say, improve it if you can. But 80% oppose repeal. The signature issue for the House Republicans and now the Senate Republicans is the repeal of affordable health care. It would be devastating if we did.